World Tuberculosis Day. It is celebrated on 24th March 2024. The theme for the year 2024 is Yes, we can end TB. Each year we commemorate World TB Day to raise public awareness about the devastating health, social and economic consequences of tuberculosis and to step up efforts to end the global TB epidemic. The date marks the day in 1882 when Dr. Robert Koch announced that he had discovered the bacterium that causes TB, which opened the way towards diagnosing and curing the disease. The theme for World TB Day 2024 is Yes, we can end TB. It conveys a message of hope that getting back on track to turn the tide against the TB epidemic is possible through high-level leadership, increasing instruments and faster update of new WHO recommendations. Following the commitments made by Health of State at the UN high-level meeting in 2023 to accelerate progress to end TB, this year focus shifts to turning the commitments into tangible actions. To help countries scale up access to TB preventive treatment, WHO will release an investment case on scaling up the rollout of TB preventive treatment. Some facts. 75 million lives were saved since 2000 by global efforts to end TB. 10.6 million people fell ill with TB in 2022. 1.3 million people died of TB in 2022. About World TB Day, the background. The TB remains one of the world's deadliest infectious killers. Each year, close to 3,560 people lose their lives to TB and close to 30,000 people fall ill within this preventable and curable disease. Global efforts to combat TB have saved an estimated 75 million lives since the year 2020. There was a significant worldwide recovery in the scale-up of TB diagnosis and treatment services in 2022. It shows an encouraging trend starting to reverse the detrimental effects of COVID-19 disruptions on TB services. In its latest global tuberculosis report, World Health Organization highlights that more than 7.5 million people with TB received access to diagnosis and treatment in 2022. The most since we began monitoring almost 30 years ago. In addition, the United Nations General Assembly high-level meeting agreed on new targets to end TB, launch the TB vaccine accelerated council to facilitate the development, licensing and equitable use of new TB vaccines. However, progress was insufficient to meet global TB targets set in 2018, with disruptions caused by the pandemics and ongoing conflict being major contributing factors. The sustainable investments of resources, support, care and information are vital to ensure universal access to TB care and for research. This is especially critical to close gaps in case and to ensure equitable access to prevention and care in line with WHO's drive towards achieving universal health coverage. More investments towards supporting the rollout of WHO recommended TB preventive treatments options than shorter TB regimens, rapid molecular diagnosis, and the tests for TB infections. Other innovations and digital tools will lead to improvement in health outcomes and save millions of lives. Importantly, investments in research and innovation are vital to fast-track efforts to reach the end TB targets. Strengthening multi-sectoral engagement and accountability. Ending TB requires concerted actions by all sections to provide the right services, support and enabling safe environments in the right place at the right time. Poverty, inequality, undernutrition, comorbidities, discrimination and stigma are major drivers to the TB epidemic. Tackling health inequalities to ensure health for all. People with TB are among the most marginalized and vulnerable and face barriers in accessing care. WHO is calling for global action to address health inequalities for people with TB and other diseases.